Hey, it's 89.9 Qute-FM. Oh, that is the jam, and that's a classic. Sam Cooke, A Change Is Gonna Come. And so, ladies and gentlemen, I told you she was going to join me in the air chair, and I am so excited to have this young lady in the air chair with me. Dr. Lawrence, welcome.
Thank you.
And before I officially introduce you, you're hanging out in the air chair. You picked that song, Sam Cooke. Why?
I did. I am a huge Sam Cooke fan. This song particularly resonates with me regarding change. I think we all go through different changes throughout our lives. Change is one thing that it is constant. It's inevitable. So I love that song.
So let's start with your heritage, man.
Yeah.
So,
born and raised in Jamaica.
Born and raised in Jamaica.
That's right.
All right. What parish?
In St. James, actually.
Okay. All right.
So my early education, perhaps my most formative years, were in Montego Bay at Malta Vernon High School in Jamaica. And my folks emigrated here in '94. I was about 15 years old at that time. And the rest is history.
And when you all migrated here, where did you come to Connecticut or where
we migrated
exactly?
to Long Island in New York, yeah,
Okay.
which what I consider is my new home now. We've been there. My folks are still there. I have two younger siblings that are there as well. You know, I've always been interested in healthcare. One of the reasons my parents emigrated here was in search of educational opportunities, better educational opportunities for my siblings and I. Shortly after I got here, I entered college at Fordham University. Go Rams!
Okay,
I'm a huge
all right.
fan of Fordham. And once I got there, I realized that my interest in medicine could actually be a reality. In terms of surgery, once I got to medical school, I would say it's early exposure. Mentorship is key. I met Dr. Gretchen Arndt, who is a breast surgeon, asked her if I could spend some time with her, and I did, and I was smitten after that.
I know there's so many different aspects of cancer, but let's just first start talking about screening and the importance of screening.
Yeah. You know, screening mammography results in early detection. And what I often tell my audience is that if we can find the cancer early, when it's too small to be felt, that's going to give that woman the best optimization for survival from the disease. So I often get patients come in and said, you know, there's no one in my family with breast cancer. Well, the overwhelming majority of women who are diagnosed with breast cancer in the United States, they are the first in their family. And screening mammography is important because you want to identify the cancer when it's too small to be felt. And there are some cancers that do not present as breast mass. They may present as microcalcifications that you or I as a surgeon will not be able to see unless the patient gets a screening mammogram. So early detection is key.
So how soon should I start having a mammogram? At like what age?
The current recommendation is age 40. However, if you do have a family history of breast cancer, that age may be even less. For example, the overwhelming majority of breast cancer that we see, we don't know what caused it, but about 10% can be due to mutations within the family. So if you do have a family history of breast cancer, it's important to have that conversation with your primary care doctor, your GYN, to see if you meet criteria for testing. Because if a mutation is identified, then the screening age changes. For example, women who have the BRCA1 mutation, the recommendation is that you would start screening mammography at age 25.
Okay. And so, listeners, if you're just tuning in, I've got Dr. Lawrence hanging out with me in the air chair. She's a director of breast surgery. And so Dr. Lawrence, I do have a question for you with regards to the mammogram. So did a man invent that machine?
Probably.
It's just so painful. I know it's necessary.
Yeah, it is necessary. It's not the most comfortable, but it's a quick test that's done. The breast does go into compression in order for you to obtain a really good image that the radiologist can confidently read. But it's not as terrible painful. In fact, I just had my first mammogram last year.
Okay.
And it wasn't too bad. And it was a necessary test for me to do.
So as you talk about necessary tests, Dr. Lawrence, and you know, I joke about that, but I know, you know, it is, it's so important to have this particular test. But let's just kind of talk about, since we're talking about cancer and you're the director of breast surgery, let's talk about preventative care. So that's one of the things to do for early detection. What are some other things that our listeners can do?
Well, I often tell patients there are many causes for breast cancer. Diet and exercise plays a role. We know that obesity increases a person's risk for not just breast cancer, but other cancers. Patients often assume the worst a lot of times. A lot of women who are diagnosed with early stage breast cancer go on to do very well and live normal lives once they've gone through the appropriate treatment. I want to talk a little bit about the Cancer Institute that's in Plainville under Hartford Healthcare and the services that we have there. What we've done is made all the services pertaining to the management of the breast patient in one single location.
Now, why is that important?
Well, that's important because the management of the breast patient extends beyond just surgery. It's really a multidisciplinary approach. So there are different experts within the multidisciplinary team that looks at every single breast cancer patient that we take care of. You're talking about excellent medical oncologists, radiologists, radiation oncologists, pathologists. We all convene every week on Tuesday morning at 7 a.m. We go through each newly diagnosed breast cancer because what we do know for sure is no two breast cancers are exactly the same. So we individualize, we personalize and tailor the treatment for that particular woman.
So it's like a one-stop shop.
It's one-stop shop. So you're diagnosed, a woman can come in, they can have their mammogram done same day. If an abnormality is found, they're given the option of seeing a breast surgeon the same day. They can have the biopsy the same day. And the turnaround time for pathology is very quick. We've had cases where we get the results back in 24 to 48 hours. What we're doing is trying to take the weight out of the equation. So it's really personalized, patient-centered care. And then for all the additional treatment that's needed, the chemotherapy, the radiation therapy, it all happens within the same building. So patients aren't traveling to different locations in order to get all the care they need. We're in one location.
Wow. And so how important is that, right? So when you go to get your mammogram, typically, like when I go to get mine, and I do the preventative care,
Excellent.
But you're waiting to get that letter, right?
Yes,
right? You're waiting to get that letter, and then you get the letter, and then it says, for me, it says, oh, you got dense breasts, all right?
Yeah.
So we want you to come on back for an ultrasound.
Yes.
But with your location,
with our setup, all those questions can be answered within the same visit. We are located at 201 North Mountain Road, and that's in Plainville, Connecticut. And for an appointment with myself, there are other breast surgeons that are within the practice as well. We have a new addition, Dr. April Duckworth, that's there. But you can call and schedule an appointment, and the number there is 860-224-5416.
All right, there it is. So listeners, if you're just tuning in, I've got Dr. Lawrence hanging out in the air chair, and she is the director of Mid-State Medical Center and the Hospital of Central Connecticut. She's the director of the breast surgery, I should say. I just made you the director of the whole hospital.
No, there's
as far as I'm concerned, look, sister got it going on.
There's
just
several
a matter of
layers
time.
of leadership above me. So my role, I'm sort of carved out director of breast
Listen to you.
surgery.
Yeah. I'm prophesying for you.
That's right. Let's claim it, right?
So I am so glad you're here, and there's so much we can talk about. I also want to talk about just your daily motivation because we're Facebook friends, and I see you posting about your children and just daily motivation.
Yeah.
And so in such a career as yours, I know it can be very stressful. What motivates you, or what are some of the things that you do that inspire you and keep you going?
Well, my patients definitely inspire me. I have an opportunity to make a real impact. I often say my career choice really wasn't a choice, but really a calling for me.
Okay.
I do enjoy what I do. And I do a lot of the Facebook posts because, I want to encourage other young women in particular who may be interested in a career in surgery for them to know that it is feasible, that someone like myself, who it's a lot of hard work and time and commitment, but you can do it. And I feel that as human beings in general, we all face different obstacles. I will tell you, my path have not been easy at all. But I've persevered. Resilience is important. So I try to post uplifting, encouraging, information to tell others that you too can get through whatever challenge or circumstances. And I share pictures of my kids. I'm married. I have 2 kids. I have a family. So it's really striking that balance. You can be a career woman and you can also have a family, and you can make it work. It does take support. from your loved ones, but it is feasible.
So what are some things, though, you do for yourself?
Yeah. So I do exercise. I enjoy leisure reading. I don't get to do as much as
Any good books you read lately?
So I am currently reading Becoming by Michelle Obama.
Oh, yes, yes.
You know, just spending time with my family for Easter. I was down on Long Island with my folks, make sure I got my Easter bun and cheese in.
Yo, man.
So I go there for authentic Jamaican cuisine. But it's, just I do a lot of community work. It's something that I'm passionate about. I have very humble beginnings, and I am who I am today and where I am today because I'm standing on the shoulders of giants. There have been tracks laid for me that I have walked, very easily on. I didn't get here alone. There are a lot of people behind the scenes who have not only helped me out, but have carried me throughout different moments of my life.
You are very modest. Thank you for that, Doctor. So I got Dr. Lawrence hanging out in the air chair with me, and what else would you like to share as we get ready to wrap up soon and jump back into some more music? I know we've been talking about breast cancer. What some of the myths about breast cancer and early detection? What else would you like to share?
Well, I want to underscore, that the prevalence of breast cancer or the incidence or new cases of breast cancer have not significantly decreased. In fact, Connecticut has one of the higher incidents of breast cancer nationwide.
Now, why is that?
We're not exactly sure, why. One thought process is that if we're screening more, we're finding more. Another is that, we do have women who are having kids later in life, so that may be an increased surge for breast cancer. But the reality is that we do have a higher number of cases per state for us. So screening is very important. But in particular, women of color, we are twice as likely to die of this disease. And some of the contributing factors, socioeconomics plays a role, but also late stage diagnosis and biology plays a role as well. And that's why screening is so important, because you want to find a disease much earlier, because that's going to offer the best chance for, survival. But there is an entity called triple negative breast cancer, which confers a more aggressive biology and increased recurrence rate of the disease. In African American women, the current data that we have available shows that triple negative breast cancer is more prevalent among women of color. And we currently, our treatment options really is chemotherapy. You can't use hormonal therapy to treat triple negative breast cancer. So I really just want to get the message out there. I cannot say this often enough regarding the importance of screening.
Sure.
In order to find a disease. And the recommended age is 40. If you have a family history, have that conversation with your doctor to see if you do need to start screening early, because we really need to push back at this disease.
Oh, yeah. And now how about, so you talked about the triple negative. I know there's been like chemo, there's been radiation. I've also heard about tablets.
So so for chemotherapy, it's usually an infused drug. For triple negative disease, you're relegated to chemo. You can't use the anti-estrogen pills. However, for women who have the hormone positive breast cancer, we've come a long way in a sense that, recently, a couple months ago, the TAILOR-X trial came out, which shows us that there was a subset of patients who were receiving chemotherapy who may not necessarily have benefited from the chemotherapy. So we now have a test that we can do. It's called an Oncotype DX test.
Okay.
And what it does is give us information about that woman's tumor and whether they'll benefit from chemotherapy. It gives us what we call a recurrence score.
Okay.
And that helps to guide the medical oncologist whether this is a woman that should get chemotherapy versus not getting chemotherapy for that mid-range patient.
Sure.
We've always known that those with a lower score, less than 10, didn't benefit, and those with a higher score, greater than 25, benefit. But there was a middle range that we still had questions about, and we were, I would say, in general, erring towards, administering chemotherapy. But so there's always research going on. There's going on to try to identify new novel therapy for the management of, the breast cancer.
So there's some hope.
Yes, there's some hope. Absolutely. Yeah. The message today is that there is hope.
Yeah.
And that our best chance for definitive treatment and survival is really early detection.
All right, there it is. There it is. Early detection is key.
Yes.
All right, ladies and gentlemen. So listen, I got Dr. Lawrence. If you're wondering who's hanging out in the air chair talking the talk, it's Dr. Lawrence. Yeah. And she's the director Director of Midstate Medical Center and Hospital of Central Connecticut, Director of Breast Surgery.
Correct.
And so I am glad that you are in the air chair. We got to jump into some more music before we do. Any questions that I didn't ask you? Give that number again. Are you accepting new patients?
Yes, we're accepting new patients. You can call the Plainville location.
Okay.
The number there is 860-224-5416.
All right. So that's how you get in contact with Dr. Lawrence.
That's right.
All right. All right. So I said you're in the air chair. We're hanging out with you. Give your first name.
It's Camelia Lawrence.
There
it starts
it is.
at Camelia Lawrence.
All right. There it is. Listen, I'll be honest. I didn't want to mess it up, you know.
That's okay.
So I got you in the air chair,
Yeah.
Dr. Lawrence. What are we gonna roll out to? Who do you have on your playlist that when you're not rocking so hard doing surgery that you're just kind of laying back, kicking it out? What are you gonna kick out to our listeners as we continue to jam?
Let's rock on out to Michael Jackson, Man in the Mirror.
All right, there it is.
That's right.
On 89.9. I appreciate you, Dr. Lawrence.
Thank you for having me.
And thank you for doing what you're doing.
Oh,
It's Qute-FM.